They tell me, Abby, don't stay late. For example, if there's a patient who need me, I stay late or overnight. Even they say, Abby, we're not going to pay you. I say, no, the money is not important. The most important for me is to help them, is to stay with them if they need me. That's what I'm striving for, to work with people, help them in their everyday life, to save their life the best I can.
Welcome to the Bronx Health REACH Community Coalition podcast. I'm Felix Rojas, and I am hosting today's podcast. I'm a community health worker with Bronx Health REACH, a 80-plus member community coalition launched in 1999 to eliminate racial and ethnic health disparities in the Bronx. For the past 6, almost 7 years, myself, along with my co-host today, Cheiko Umar Ann, I've been doing outreach for the Immigrant Health Initiative led by Bronx Health REACH and its parent organization, the Institute for Family Health. The Immigrant Health Initiative is a program that focuses on decreasing health disparities among foreign-born New Yorkers, regardless of their immigration status. Funding for this program is provided by New York City Council. We focus on 3 goals: promoting access to health care, dismantling cultural and language barriers to needed health care, and increasing access to resources and interventions. We partner with New York lawyers for the public interest that provides pro bono legal consultation and public health solutions that provide health insurance. For today's podcast, we'll be talking with Abby Wague, a community health advocate at the Islamic Cultural Center in the Bronx. She does outreach to and hosts health fairs and screenings with Islamic centers and African and Latino consulates in New York City. With over 16 years of experience in immigration law, Abby brings a wealth of expertise in petitions, case management, and client support. Over the course of her career, she has managed more than 300 cases, maintaining a 100% success rate with no client denied initial or renewed status. Abby has worked closely with attorneys and partners on cases that granted foreign nationals the ability to work in the United States. Beyond her legal work, she's deeply committed to community engagement. She organizes health fairs and screening at Islamic centers and at African and Latino consulates, helping to connect underserved and undocumented populations with vital healthcare resources. Fluent in English, French, Fulani, Wolof, Mandingo, and Diula, and conversant in Spanish, Abby bridges cultural and linguistic gaps, making her a trusted advocate and connector across diverse communities. Abby, thank you for joining us.
Hi, everyone. Thank you for having me, Felix.
Of course, you welcome to this podcast together with my brother Cheiko Umar. To take my hat off to you for the work that you do, not only for the Muslim community, but the Latino as well. So thank you again for the invite.
Thank you for inviting me.
Great, Abby. I think I'm going to go with the first question I'm going to ask you. I want to tell us your role at the Islamic Cultural Center in the Bronx, and how long have you been involved in this role?
Thank you, Seiko, for the question. I'm working with the Islamic Cultural Centers since 2008, when I moved to the Bronx, where I help them connect with local resources like the hospitals and I help them connect with the local resources, the youth programs, the women's. I help women organize themselves in the masjid and explain to them the importance of doing their mammogram and all that stuff.
Yeah, it's so true, because I had seen there when you install. I was by there one day when I saw them installing like a blood pressure machine. It's been a while ago. That was the first one I saw being installed at the masjid. And thanks to you, I heard so many things about you talking. They've been talking about how helpful you was with them. But how does those initiatives you do help immigrants seeking healthcare?
Okay, when I go to the masjid, Islamic centers weekly, weekly, I go there every day, but weekly I have a health fair where I can check their blood pressures. And sometimes I find some people who are like the 200 plus, like blood pressure. The blood pressure is high, and I have to call the ambulance to take them to the hospital. And for those who don't have, who are undocumented and don't have medical insurance, you have to explain to them that they can get health care without, regardless of their immigration status. Sometimes they scared to go to the hospital because of that.
Yeah.
Okay, Abby.
Okay. Because you're so right, because so many people that told me, like immigrants that told me you are helping them, even if they're not insurance, getting something, I think they used to call it NYC care.
Yeah, we have NYC care that you can have help. You can get care without being documented.
Right. Is that the same thing as the other one? It used to be called scale fee, right? Something
Fee
like that.
scale is better than
Scale.
fee scale.
Okay.
It's better than the fee scale because the fee scale you have to pay a few dollars. But this NYC care usually don't pay nothing. They take care of you. It's but yeah, it's the same. It's not the same. It's a little bit better than the fee scale.
Right.
Abby, like I say, I'm quite amazed by the work that you do. But the next question, to me, it's very important, like for the podcast itself. What you say? Which communities do you focus your outreach, and are there particular immigrant group that you focus on? But before you answer, I gotta say this: the importance of this question is, uh, I'm not gonna answer this for you, but you stretch yourself for other communities, and sometimes I ask myself how you do that, and then again the question is, which communities do you focus your outreach, and are there particular
My
immigrant groups that you focus on?
my outreach is to connect New York City residents with all the city services and help them make sure their voices are heard in the local and also I help them. I have no boundaries. I help the Latinos, in particular Latinos and African communities. That's my main focus. But I help other communities too, like the Bangladesh community and Pakistanis community in the Bronx, like the around Yonkers. They have a community, Bronx, Pakistanis and Yemeni, and Yemen, Pakistan, Yemen, Bangladesh community.
Okay.
But
So,
the main communities are the Latinos and Africans.
what are the outreach strategies that you use to successfully connect with immigrants?
Mostly the language, because I'm not good in Spanish, but my broken Spanish is my broken Spanish with the Latinos and the Africans. I speak a lot of African languages, so when they come, they are more comfortable if I'm there. Yeah.
Yeah, I have to a quick thing that happens a few years back when the pandemic started. When I met you, I was pushing the English. Let's see how I'm gonna connect with this beautiful Muslim girl, and all of a sudden, I'm talking in English and you respond me in Spanish. So I'm like, oh wow. So I say like how multi-talented you are, and actually I seen you not talking in your own language, but other languages as well. And when I tell people that I know somebody's going to help you, and they say, but I don't speak English. I say, you know what? But you're blessed enough because she can speak Spanish. So they are at ease. And actually, communication is a plus for the work that we do. Through communications that you can feel that put them at ease, with the service, and they can open more, to the service that they want.
Yeah.
That's so true. I'm just saying that because on my first time I was doing outreach in the masjid, I remember those two first masjid I went, they said they wasn't gonna tell me no information unless Abby Wague come through. I said, who is Abby Wague? Why is it so important? So I stayed there 2 hours to wait for her to come. I see this short lady coming down, running this show, asking me question like she's the But it was nice. That was the day we connected. So I found out she was very involved with more than 10 or 15. I don't know how many matches she's involved too.
Yeah, language is the most powerful tool in community work. You can
Right.
build bridges, foster trust. They can trust you, and with the language you can empower people too.
Yeah. But a question I'm asking Abby always, what attracts you to this kind of work? What made you want to do this?
I don't know. It's just natural. I don't
Right.
know. It's just natural. I like to help people. That's it.
Yeah, but how you manage with your family life? Because family was Freddy was asking me earlier,
They used to it.
how you manage all this time you put up with this work and your family time? That's very serious.
Yeah, because my husband is very understanding, so he helps a lot too.
Mm. Abby, in the time that you have been doing this, what effect or impact have you seen on the immigrant communities that you serve?
We see, like the stroke went down a little bit. Usually every day we have somebody who fall in the masjid with a stroke. But since we start giving them the blood pressure thing, they to check their blood pressure regularly on a regular basis and monitoring them, bringing them to the hospital, the stroke went down. And people also are more comfortable coming to the hospital. Especially when I'm there, they come looking for me, so I navigate with them through the system.
That's so nice because I know that Lincoln was saving so many things, especially around the immigrant community when they come the last minute at the hospital. I know that they had saved so many people when it come to stroke, and we just did a stroke event. That you was the main leader there, so I know how much you work on it. But when I say what was the most rewarding part of working at the Islamic Cultural in the Bronx, I know you do so much for them. And what do you think that the reward you have from doing all that? What's the most rewarding part?
Mhm. Rewarding. I don't know how to explain that because even at my work at Lincoln Hospital, they tell me, Abby, don't stay late. For example, if there's a patient who need me, I stay late or overnight. Even they say, Abby, we're not gonna pay you. I say, no, the money is not important. The most important for me is to help them, is to stay with them if they need me. I'm gonna get, if I don't get a reward from you, I'm not looking at a reward from you. I'm looking at a reward from my God. So that's what I'm striving for, to work with people, help them in their everyday life, to save their life the best I can.
Great. I have to say that by the time like I said, I've been blessed enough to meet to be in partner with Abby, and I just have to say the extra mile that she always goes. Like we had cases into a situation that had nothing to do with you, Abby, at all, and you keep asking, and then you keep uh, asking for that person, or you didn't text, or you send an email, or you call, and then I say, you know who called me, Abby. I say, yeah, don't expect that from Abby. She is like that, and even you go into the extra mile with cases that we had, that you even went like, Felix, what is you need? What is that person needs? Please tell them to call me. And at any time, I'm like, yeah, but you cannot be abuse of your time. And you say, no, I'm always on call 24/7. And I do really appreciate talking, speaking from the Latino side, from the Latino perspective. And every time I speak or call any of these people that we help through you, they always send you like hug and kisses and how's Abby, how's Abby, how's Abby. So an instance, we got cases lately that I call you and say, Felix, don't worry about it, just bring it. We're gonna find a solution. Is there any other information you'd like to share about the Islamic Cultural Center in the Bronx and the services they provide to the community?
At the Islamic Cultural Center, they typically serve as a hub for spiritual, educational, and community life. And it's open to all Muslims, even a non-Muslim sometime came to the masjid, for example, to have food. Yeah, it's the masjid is open to Muslims and non-Muslims. They offer they offer the location location they offer to the youth to have their activities there. Like right now, they're having the summer programs for kids, and they have workshops there like parenting or Islamic finance, and they have guests that come from all over the world to do lectures. They also have the sisters halakha, the sisters classes, and the youth groups too. Like the youth group usually talks to the Guns Down Life app. It's a program, non-violence program at Lincoln Hospital that comes over there. Talk about violence, to prevent violence. They talk to the youth about how to prevent violence.
That's great. That's great. Well, I'd be involved
They
with.
also have food banks.
Oh, they have food banks there. Yeah, that's why the
Yeah.
food pantries and stuff. Yeah, and the food pantry too.
Plus the health screening that was done there with you guys and Lincoln Hospital.
Right. We did joint venture with vaccinations there.
Yeah.
We did the exactly health screening, pantry. A lot of city officials, like city councils, come by the masjid. I seen that for different things. And I remember that that masjid was the center of a lot of helps during that Bronx fire. That that I know it contribute a lot to help those family that was.
Yeah, they have them. They have them access to imams and or chaplain for personal issues, guidance, and emotional support during those kind of disasters.
Oh, great. But from what do you share, how can someone get more information about what you just shared about those services at the Islamic Cultural Center?
They can get it on the website or at the physical address at in person at 371 East 166th Street, Bronx, New York.
And what will be the website?
It's IslamicCulturalCenter.com. I think that's right. The public relations phone number, his number is 917 568 5763.
Well, and then thank you, Abby, because you take time out of your busy schedule to be with us, with Chequan Umar and me, Felix Rojas. Then again, thank you for the service that you provide for the community, for the Muslim community, the Latino community. And I'm proud to be part of the work that you do. And I know that I can count with you like 24/7 with the respect of your time, because I know how busy you are. Chequan.
Oh, thank you, Abu, for taking the time and being the savior for a lot of us, because so many times we had emergency that we don't know where to send out our people. So that was good that we was able to send it to you, and then you can refer them to your jobs and whatever, that's thank you again. And keep up the good job and give some time to your family.
Thank you for having me.
Yeah.
You've been listening to the Bronx Health REACH podcast. You can email Bronx Health REACH at bxhealthreach@gmail.com. You could find Bronx Health REACH on social media. For Facebook, Bronx Health REACH. For X and Instagram, BX Health REACH. And on Blue Sky, bxhealthreach.bsky.social. The views, thoughts, and opinions expressed and presented by our guests here on the Bronx Health REACH podcast are their own and do not necessarily represent the views, thoughts, and opinions of Bronx Health REACH and the Institute for Family Health.